and welcome to the National Press Theatre. I'm Elizabeth Thompson with CBC. Bonjour et bienvenue au Théâtre National de la Presse. With us today we have Deputy Prime Minister Chrystia Freeland, Health Minister Hajdu, Chief Public Health Officer Dr. Theresa Tam, and Deputy Chief Public Health Officer Dr. Howard New, who will be giving us an update on the government's work on the coronavirus disease. Ms. Hajdu?
Well, thank you very much, and good afternoon, everybody. It's a joy to be with you here on the traditional territory of the Algonquin people, and I want to thank you for joining us today to give you an update on the coronavirus. Over the last several days, we've seen an increase of cases in Canada, and the outbreak of COVID-19, as the coronavirus is formally named, is evolving rapidly across the world. And we've been continuing our work, as you know, to contain and delay the spread of this virus in Canada. Since January, my provincial and territorial counterparts and I have been working closely with local health officials to prepare for the potential of any community outbreak. And our discussions and work has focused on ensuring that our surveillance systems are detecting cases and our health systems are prepared for an increased activity. This morning, I also spoke with Secretary Azar, my health counterpart in the United States. Our government continues to focus on protecting the health of Canadians by working closely with provincial and territorial partners, Canadian organizations, the research community, as well as global partners and organizations. In early January, our government commenced scenario planning to help us assess the impact of the continued coronavirus outbreak on Canada. And our officials have been working on these plans to give our government options as the situation evolves. We have already seen global economic and supply chain disruption, and it's important that Canada be prepared for the effects of this new virus beyond those of health. The Prime Minister announced this morning a special committee of ministers that will allow us to use the information we've been working on and make quick decisions as situations arise that relate to the global and domestic impact of the coronavirus. This special committee will support our ability to rapidly respond to a very fluid situation. Ce comité est une étape de plus dans la réponse du Canada aux effets du virus. Il nous permettra de faire face aux impacts du virus sur la santé des gens, mais aussi sur l'économie. I will now turn to Minister Freeland to give an update on the first committee meeting.
Okay, well, thank you very much, Minister Hajdu, Patty. Bonjour tout le monde. Le comité sur le virus COVID-19 a tenu sa première réunion aujourd'hui. Il a pour mandat de veiller à ce que le Canada soit prêt à toute éventualité, et nous le sommes. Il s'agit d'un effort à la fois d'ensemble du gouvernement et de l'ensemble du pays. Nous prenons très sérieux l'éclosion du COVID-19. Cette situation évolue rapidement de jour en jour. So today we had our first meeting of the Cabinet Committee on the Federal Response to the Coronavirus Disease, known as COVID-19. The job of this committee is to ensure that Canada is ready and prepared for all eventualities, and we are. This is a whole of government and indeed a whole of country effort. We take the COVID-19 outbreak very seriously. And we are very aware that this is a situation, as Minister Hajdu has just explained, which is evolving rapidly day by day and indeed hour by hour. Our first priority is to keep Canadians safe. That is what we will do. I'd like to stress 3 further points that should give Canadians confidence. First, we have one of the best healthcare systems in the world, and we have among the best healthcare professionals in the world. I am very confident in our ability as a country to deal with this. And I would really like to thank and recognize the exceptional leadership of my colleague and friend, our Minister of Health, Hajdu, and of course our Chief Public Health Officer, Dr. Theresa Tam. They have been, as Minister Hajdu has just said, working very, very intensely on this situation for months. They have been keeping the entire government, starting with the Prime Minister and the provinces, extremely well informed, and I must say their predictions of where things would be going have proven to be very, very accurate. Deuxièmement, le gouvernement du Canada suit de près l'incidence économique du coronavirus, tant au niveau national qu'international. Hier, à la suite d'une téléconférence entre les ministres des Finances du G7 et les banquiers centraux, les pays du G7 ont indiqué dans une déclaration que nous sommes prêts à mettre en place les mesures fiscales nécessaires. Secondly, the Government of Canada is very closely monitoring the economic impact of coronavirus, both domestically and internationally. As Canada and our G7 partners said yesterday in a statement, following a call between G7 finance ministers, including, of course, Minister Morneau, and central bankers, we are monitoring the outbreak and we remain ready to deploy fiscal measures as appropriate. As Minister Morneau has said, Canada's fiscal position is strong, which means we as a country are very well positioned to face big challenges. Thirdly, Canadians have a long history of coming together as a country to confront big and serious challenges, whatever they may be. That is who we are, and that is what we do. That is what we have been doing when it comes to coronavirus, and that is what we will continue to do when it comes to addressing the challenge as it evolves. I'd like to close by assuring Canadians that this response will be a national response. We have been working very closely with our provincial and territorial colleagues, and we will continue to do so, and we are united in our commitment to keep Canadians safe. I've been working closely, directly with the premiers for weeks. My colleague, Minister Hajdu, has been working very closely with provincial ministers of health, and the Prime Minister and I are looking forward to meeting with the premiers in Ottawa next week, when this issue, of course, will be on the agenda. Merci beaucoup. Dr. Tam.
Good afternoon, everyone. I'll begin with an update on cases reported in Canada. As of right now, we have 33 confirmed cases of COVID-19 reported to the national level, 20 in Ontario, 12 in British Columbia, and 1 in Quebec. All cases are related to or close contacts of travelers that visited China, Iran, and Egypt. However, please remember that the situation is evolving rapidly as health authorities in the provinces and territories continue to investigate and test individuals, so these numbers are subjected to change on a regular basis. Globally, the situation is evolving rapidly, with approximately 80 countries reporting cases. And the message from the World Health Organization is that the actions countries take today will make the difference between a handful of cases and larger clusters. At this time, there is no evidence of community spread of the virus in Canada, with all cases directly or indirectly linked to travel. Even so, while our focus continues to be on containment to delay the onset of community spread, we are fully engaged in preparedness across the health system. The Public Health Agency of Canada continues to work very closely with provinces and territories to ensure a consistent and collaborative approach that is based on the best available evidence. In particular, health authorities at all levels of government have been adapting Canada's well-established and tested pandemic influenza preparedness plan to address the specific challenges of a COVID-19 outbreak. While we recognize that COVID-19 and influenza are different entities and they're distinct respiratory infections, there are enough similarities for this plan to provide us with a solid foundation and an advanced starting point for a comprehensive response. At the federal level, the Government of Canada is exercising a leadership role and working closely with provinces and territories to facilitate their plans for Canada-wide readiness and response. Our work includes issuing national guidance on public health measures, schools and childcare, clinical management and self-isolation, and caring for others in the home. We assist with bulk procurement of essential supplies and help provinces and territories address their needs. We conduct national disease surveillance to monitor and inform the response. And our National Microbiology Laboratory provides key support for laboratory diagnostics and capacity, and we support and undertake research to advance science, improve diagnostics, and develop therapeutics. Let me conclude by saying that it is natural to be concerned about what COVID-19 might mean for you and your family's health. This is a concern that public health authorities across Canada are taking very seriously, and government at all levels are engaged in the response and actively planning and adapting to meet the challenges of this evolving situation. There are things that everyone can do to protect their health, delay spread of COVID-19, and minimize the overall impact across our communities. Simple everyday hygienic measures practiced well and maintained at all times can and do have an impact. Wash your hands well and often, cover your coughs and sneezes, and stay at home if you're sick to prevent the spread of illness. Thank you.
Merci, Dr. Tam, et bon après-midi à tous. Je vais commencer par faire le bilan des cas signalés au Canada. Jusqu'à maintenant, nous avons eu 33 cas confirmés de COVID-19 à l'échelle du pays, soit 20 en Ontario, 12 en Colombie-Britannique et 1 au Québec. Tous les cas sont liés à des voyageurs qui sont allés en Chine, en Iran, en Égypte ou à des personnes qui ont eu des contacts étroits avec eux. Cela étant, n'oublions pas que la situation évolue rapidement et que les autorités sanitaires des provinces et des territoires continuent d'évaluer l'état de santé des personnes soupçonnées d'être infectées, ce qui veut dire que ces chiffres peuvent changer continuellement. À l'échelle internationale, la situation évolue rapidement puisque des cas sont maintenant signalés dans environ 80 pays. L'Organisation mondiale de la santé fait circuler le message suivant. Les actions que les pays entreprennent aujourd'hui feront la différence entre un petit nombre de cas et un grand. À l'heure actuelle, rien ne prouve qu'il y a transmission communautaire du virus au Canada, étant donné que tous les cas sont liés directement ou indirectement à des voyages. Il reste que, même si nous continuons d'axer nos efforts sur le confinement afin de retarder le début de la propagation communautaire, nous travaillons activement pour que tous les systèmes de santé soient prêts. L'Agence de la santé publique du Canada continue de collaborer de très près avec les provinces et les territoires pour veiller à ce que l'approche adoptée soit cohérente, axée sur la collaboration et fondée sur les meilleures données probantes connues. Plus précisément, les autorités sanitaires de tous les ordres de gouvernement sont en train d'adapter le plan canadien de préparation à une pandémie de grippe qui est bien établi et éprouvé pour tenir compte des défis uniques qui présentent une éclosion de COVID-19. Bien que nous sachions que la COVID-19 et la grippe sont des infections respiratoires différentes et distinctes, il y a assez de similitudes entre les deux pour que ce plan serve de fondement solide et de point de départ avancé pour une intervention globale. Au niveau fédéral, le gouvernement du Canada donne l'exemple et collabore étroitement avec les provinces et les territoires pour les aider à élaborer leur plan de préparation et d'intervention à l'échelle du pays. Notre travail comprend notamment la diffusion des lignes directrices nationales relatives aux mesures de santé publique, aux écoles et aux services de garde d'enfants, à la gestion clinique ainsi qu'à l'isolement des personnes à la maison et aux soins offerts aux autres membres de leur ménage. Nous facilitons l'approvisionnement en grande quantité de fournitures essentielles et aidant les provinces et les territoires à combler leurs besoins. Nous effectuons une surveillance de la maladie à l'échelle nationale pour observer et orienter l'intervention. Notre laboratoire national de microbiologie offre un soutien essentiel en matière de diagnostic et de capacité de laboratoire. Et nous soutenons et réalisons des études pour faire progresser la science, améliorer les diagnostics et mettre au point des traitements. En guise de conclusion, je dirais qu'il est tout à fait normal d'être inquiet face aux répercussions que la COVID-19 pourrait avoir sur votre santé et celle des membres de votre famille. Les autorités de santé publique de tout le pays prennent ces préoccupations très au sérieux. Tous les ordres de gouvernement participent à l'intervention et travaillent activement pour se préparer ainsi que pour s'adapter aux défis de cette situation en évolution. Nous avons tous un rôle à jouer pour protéger notre santé, retarder la propagation de la COVID-19 et réduire au maximum les répercussions globales sur nos communautés. Des mesures d'hygiène quotidiennes simples, bien exécutées et constamment respectées ne sont pas sans effet. Lavez-vous les mains souvent et comme il faut, toussez et éternuez dans le creux de votre coude et restez à la maison si vous êtes malade afin de prévenir la propagation de la maladie. Merci.
Merci beaucoup. C'est le moment des questions, time for questions. Be one question, one follow-up. There are two gentlemen who will hand you a mic so that the interpreters will be able to hear the question as well as the answer. First question goes to Joyce Napier, CTV.
Good afternoon, ministers and doctors. We've spoken to a number of health professionals who do have some serious concerns. There is a shortage of beds in Canada. The healthcare system, as good as it is stretched thin. If there is an outbreak in Canada, are you confident that the healthcare system will be able to handle it?
Well, I'll start and I'll turn to Dr. Tam because Dr. Tam has been working very closely with the healthcare sector as well as her provincial and territorial partners as public health officers. This is the work that is underway right now, is to ascertain with provinces and territories what they anticipate their needs would be should they see a community outbreak. And in fact, part of the effort that we're making right now to contain and delay any kind of community outbreak is really to allow the healthcare system to get through what we are seeing as a significant influenza season. If we can delay, obviously, community transmission to beyond the normal, typical flu season, then we can actually provide some slack in the healthcare system to address things like shortages of beds and you know, the burden on healthcare systems that oftentimes flu season exacerbates. In terms of equipment that I know hospitals have talked about, that is one of the roles that the federal government can play and is actively investigating and preparing for right now. Things like ensuring that we have adequate personal protective equipment for frontline workers and additional ventilators should people get to the point where they need to be you know, intensively cared for if they have a severe expression of the illness. So I'll turn to Dr. Tam, maybe want to provide a few extra words about that work.
Well, I think, Minister, you provided quite a comprehensive answer. Only to say that everyone actually has a role to play. So I think part of this is that don't show up in the emergency room when you are sick with COVID-19 symptoms. Call ahead and make sure that you're not negatively impacting those health care facilities. And some patients, in fact, a vast majority of people with COVID-19 have milder symptoms, and such patients can be cared for in the community while reserving, of course, very scarce resources potentially for those who really need it. So I think everybody can sort of play the role in helping the health system. But having said that, every jurisdiction, every province is looking at all of their pandemic planning assumptions. They're looking at what kind of requirements they may have in terms of beds. But they are going to have to coordinate what's going on in the hospitals in terms of, for example, they may need to make decisions about postponing elective surgeries. And there's a whole number of things that hospitals have already planned for before, and we'll be sort of looking at it with a fresh eye as we understand the science of this virus a little bit more. But certainly protecting the health system, protecting, I would say, long-term care facilities too is very important with this particular virus.
Yeah, and I just want to pick up on something Dr. Tam has said. You know, we are very mindful that this is really about strong and close cooperation between the provinces and the federal government. As I said, Minister Hajdu has been working very closely with her provincial counterparts. I have been, and the Prime Minister has been in touch with premiers. We are very mindful of the fact that this is going to be an issue where, when it comes to our health care, we have to work effectively together. We're doing that. It is a very good thing that we have a First Ministers meeting next week, and the federal government very much understands our responsibility to provide leadership and coordination, and that's what we're doing. And I really want to say the cooperation with the provinces has been terrific. The provinces are very focused on this. They're really stepping up. I don't know if Patty wants to say anything about the provincial health ministers.
Well, just that we have a weekly meeting as well as the many technical meetings that are happening under Dr. Tam's leadership, which are more frequently than weekly, but the political ministers of health are meeting weekly as well so that we fully understand what the requests are and what the needs are as they emerge from our technical advisors and professionals.
And Dr. Tam, you talk about a certain behavior, wash your hands, cough in your elbow. Yesterday, the BC health officials spoke of human contact and of lessening that. Do you suggest that that is also something to do to prevent the spread of COVID-19?
Well, we do know that this virus is spread by these droplets coming out of people's noses and throats if you're coughing or sneezing, and if it's on your hands, for example, or on surfaces. So certainly there's been suggestions that if there's illness in your community, reducing the amount of touching between people is one method. So there's been a number of ideas in different communities as how you actually reduce that. So I think you're hearing some of these ideas from different communities as well. You know, instead of handshaking, you do, you know, elbow bumps, or you do greetings a little bit further apart from each other. So these are just some of the ideas. I think Canadians do have those ideas. They know how they can personally reduce those kind of contacts. But the most important thing is to stay home if you're sick and not spread your germs with amongst other people.
Okay. Matthew Goyer, Radio-Canada.
Bonjour, Madame Freeland. D'un point de vue plus économique, êtes-vous prête à mettre en place des mesures pour aider les entreprises qui pourraient subir des contre-coups de cette épidémie de coronavirus durant la crise? Si oui, quand et comment?
C'est une très bonne question. Et on comprend qu'on a déjà vu les effets assez forts au niveau d'économie globale et on a commencé à voir les effets ici au Canada. C'est une des raisons pour lesquelles le Premier ministre a organisé notre comité des ministres. Une des priorités pour le comité, c'est de suivre très très proche les effets économiques, ce qui se passe au niveau économique et d'être prête à réagir. Et je veux encore une fois citer Bill Morneau, notre ministre des Finances, qui a assuré les Canadiens cette semaine que le Canada a la capacité fiscale à réagir.
Parlant justement de capacité fiscale à réagir, est-ce que ce sera inclus dans les calculs du budget? Est-ce que ça fait partie des facteurs qui seront évalués alors qu'on est en train de confectionner le budget finalement?
On est maintenant en train de faire une analyse très, très exacte de ce qui se passe au Canada et aussi dans l'économie globale. Comme tout le monde comprend, c'est une situation en évolution. Mais je veux vraiment assurer les Canadiens que le ministre des Finances, tous les ministres avec les dossiers économiques et moi, en tant que président de ce comité et de vice-premier ministre et évidemment le Premier ministre, nous comprenons que c'est un aspect très important d'un pays du coronavirus et on va réagir quand ce sera nécessaire.
David Cochrane, CBC.
Hi, Deputy Prime Minister. We understand the government is ready to help the economy on a macro level. But on the much lower level, for example, hourly wage workers who may not have sick leave, may not have a lot of savings, if they get sick with this or are forced into self-isolation because of contact for the greater community good, what can you tell us about what specific measures the government is considering to help people sort of at that level of the economic ladder who are financially vulnerable?
Excellent question. And we are not here today to announce any economic measures. We are here today to assure Canadians that the government is very aware of the broad economic and I would even say potentially social impact of coronavirus. And that's one reason that the Prime Minister has convened this cabinet committee to be looking very closely at what that impact may be. And you're quite right that there is potentially the macroeconomic impact, but there are also sort of smaller microeconomic impacts on people's personal lives. So we are looking at all of that. This is a situation which is evolving, but the government absolutely is analyzing very carefully what is the situation today. We are looking carefully ahead at how it is and may evolve, and we will be ready to act when it's necessary.
Minister, it might be a question for Minister Hajdu or Dr. Tam, I'm not sure. In terms of travel screening, we didn't know Iran was going to be a big problem here until Iran was a big problem here. And there have been some calls to extend screening to all international passengers, for example. Considering that almost all of the cases are travel-related as the primary cause, or at least the contact with them, at what point do you consider broadening and expanding the screening of international travelers coming into all Canadian airports?
Well, thanks, David. That's an excellent question, one that a lot of Canadians are asking. Certainly, we do have information available now for all international travelers as they come back or come into Canada about, first of all, to monitor their symptoms and what they can do if they are feeling unwell or unsure, connecting them to local public health or provincial public health authorities so they have a point of contact. But I think, although it seems counterintuitive, in fact, the more countries that have outbreaks, the less relevant borders become. A virus knows no borders. Right now, we've applied new measures to Iran simply because it became very clear that Iran was dealing with an outbreak that even they didn't know they had, which resulted in a wide community transmission in Iran, which was obviously driving new cases globally. But as outbreaks continue in countries to expand and to grow, in fact, it becomes more of an issue around using those resources to contain domestic spread. So you can imagine that if, in fact, we have our own community outbreak and we are unable to contain transmission, that, in fact, that is a situation of greater concern and, one that we would have to really, redeploy resources to address. So, this is a delicate balance, and I know Dr. Tam struggles with this as well on a day-to-day basis about where it is that you decide that global containment, meaning border measures, is no longer really relevant. And I'll turn to Dr. Tam to give you a little bit of the sort of medical assessment on those decisions.
Well, I agree, with what the minister has said, is that there's now so many countries with this virus that it now becomes a broader piece of public awareness and behavioral change as well. The border is never a specific spot where you pick up cases or diagnose cases. It is the spot where you provide people information as to what they should be watching out for and what they should do if they get sick, particularly a number that they can call if they are concerned. Because this virus, as many of you already know, has an incubation period of 14 days. People come in where they're not sick. They may not even know that there is a virus going in their country, such as, travelers in Iran several weeks ago would have never known that they would have been in contact with anything. So our advice is that all travelers who have been on international travel and they're concerned about COVID-19, either because they've heard about what's going on and where they came from, we're watching their symptoms very closely, because the moment you get sick, you should isolate yourself and call ahead to the health line and to alert health authorities. This has worked really quite well because, remember, we detected the first case from Iran and then from Egypt before Egypt is really reporting many cases. So we believe that travelers and Canadians are quite sensitized. So they're presenting to the health system in a very appropriate way, being fully alerted. It's also a balance for the health system. We just talked about impact to the health system. There has to be some guidance into how you triage patients going through the health system. The border actually is a great place to tell them which phone numbers to call ahead so that your emergency rooms or your clinics are not inundated should you not be required to show up as well.
Okay. Catherine Levesque, Presse canadienne.
Merci beaucoup. Mes questions, en fait, sont pour Madame Freeland. Tout d'abord, donc, vous avez eu votre première rencontre aujourd'hui avec le comité spécial. Je me demandais, qu'est-ce que vous avez... premièrement, avez-vous pris des décisions à cette rencontre-là et qu'est-ce qui s'est passé concrètement lors de cette rencontre?
Merci pour la question. Pendant cette rencontre, on a commencé avec une mise à jour de la ministre Hajdu et du Dr Tam. Et je veux souligner qu'on a eu déjà au niveau du cabinet, entre des groupes de ministres, beaucoup des discussions sur ce sujet. Ce n'est pas la première fois qu'on l'a discuté. Mais la chose que je pense était importante, c'est qu'on a eu la discussion avec la ministre Hajdu et les ministres avec les dossiers surtout économiques. Le ministre Blair était sur la ligne aussi. Et nous pensons que maintenant, nous sommes dans une étape quand c'est nécessaire d'avoir un plus haut niveau de coordination au niveau du gouvernement entier. On a discuté la situation du côté de santé publique et on a aussi discuté tous les enjeux économiques qui étaient déjà soulevés par vous, les journalistes. On a aussi discuté le côté de coopération provinciaux fédérale. C'est seulement la première rencontre. Notre comité va eu une itinéraire des réunions très suivantes. Je vais parler avec le Premier ministre et lui informer de ce qu'on a décidé. On prend la situation au sérieux. Et nous voulons aujourd'hui assurer les Canadiens qu'ils peuvent avoir la confiance dans le leadership fédéral au ce dossier, que nous avons une coordination dans tout le gouvernement fédéral. Nous avons la coordination avec nos homologues provinciaux et avec nos homologues internationaux.
À jour sur les impacts économiques, mais concrètement, à quoi peut-on s'attendre lors des prochaines rencontres? Quelle sorte de décisions pourriez-vous prendre? Peut-on parler de compensation, par exemple?
Une des raisons pour organiser le comité, c'est vraiment pour nous permettre de prendre les décisions plus vite. Pour la première réunion, je pense que ce n'est pas le moment de prendre des décisions, mais le fait que nous avons maintenant un comité du cabinet avec un groupe de ministres nous donnera la possibilité de prendre les décisions vite, parce que, comme nous avons déjà écouté de Dr Tam, de la ministre Hajdu, c'est une situation au niveau de santé qui a une évolution qui n'est pas complètement possible de prévenir. Alors, nous sommes prêts maintenant à réagir si vite que sera nécessaire.
Okay, we're starting to run out of time here. Chrystia Kirkup, Globe and Mail.
Thank you. Good afternoon. My question is for the Deputy Prime Minister. Business groups are seeking a formal role similar to that was created with the NAFTA Advisory Council, specifically to deal with the government's approach to coronavirus and the economic impacts. Just wondering, if this is something that you're looking at. We understand you've been speaking to business leaders about a Team Canada approach. So what does that mean? And are you looking for a formal role with outside experts on this?
That is a great question, and I have been, as have other ministers, very actively talking to business groups, to business leaders. Just over the past few days, I've been having meetings with bank leaders, with leaders of some of our leading business organizations. I spoke to Perrin Beatty this morning, and I know that my cabinet colleagues have been doing the same thing, and we heard at our cabinet committee meeting about all of the very active meetings and conversations ministers have been having. In terms of a formal engagement of business, labor, civil society organizations, and so forth, that's something that we are going to be talking about in the coming days. I do think, though, that the important thing to underscore is that this really does need to be a whole of country response. This is a situation which, of course, is a public health situation. It's a situation which has economic consequences, which has international relations consequences. And I think all of us are, first of all, going to need to take some personal responsibility. Dr. Tam has offered some very clear and specific things each one of us should be doing. And we're all going to have to be coordinating very closely. That is something we have already been doing, and it's something that I think we are going to continue to do in a really stepped up way. I see Patty leaning forward, so
I am a little,
I think
yeah.
you have something
Well,
you
I
want
do.
to say.
I do think along the line, and it's a great response. I do think along the lines of business preparedness, there is some thinking happening through various chambers of commerce. For example, I just got a great document from the Calgary Chamber of Commerce that I haven't had a chance to read yet, but around how they start to support businesses, small, medium-sized, and even larger businesses, to think about business continuity if, for example, there were a number of people off. So, are there elements to running your particular business or in your sector that you can actually have facilitate people working from home? I mean, just recently this happened to me with an employee that in my constituency office who came to work, insistent that she was going to be at work that day because she felt such a deep sense of personal responsibility, and yet I had to send her home. And there was a way for her to be able to work remotely from home, and really, starting to wrap our heads around as employers, and many of us are as members of Parliament employers, our own personal responsibilities to make that easier for people to telecommute or to, take the time that they need if they are symptomatic with a cold or with a flu, but still really wanting to come to work. How can we actually facilitate them to do that work in a way that doesn't put the health of their coworkers at risk? And that's really important considerations. It sort of ties into your whole of Canada, Minister Freeland's whole of Canada approach. I mean, it isn't just a government's response that's necessary. It's also, employers and individual employees' responsibility to take illness seriously and think about how we respond in a way that maybe we haven't had to stretch to do previously.
And I just want to add one other quick thing, if I could. I really want to say I have been personally really struck by the civic-mindedness of Canadians in this situation. Business leaders have been proactively getting in touch with me and ministerial colleagues, leaders of civil society, schools. I think Canadians really do understand that we all need to take responsibility and we all need to work together, and that is great. We are very prepared to provide federal leadership. That is what we are doing. That's what we're going to continue to do. And we're going to work to be sure that our whole country works together on this, as we are doing.
And just as a quick follow-up, do we have an update on the number of travelers that are coming in each day from Hubei and from Iran?
We do have numbers. I would hesitate to give them to you, but we'll get that on background to you so that you have the very specific numbers, data.
Okay.
Do you have that information, Dr. Tapp?
Yes, there's actually very few travelers from Hubei on a daily basis. So, and they're not more than sort of 50 to 70 travelers. Quite a few more from Iran. And I think there's no specific trend that we can sort of comment on right now, but there's quite a few more travelers from Iran.
Thank you.
Okay, as I said, we're almost running out of time, but we have 1, 2, 3, 4 people still on the list. Mike Lecouture at Global Television.
So I wanted to know, well, it might be either Dr. Tam or Mr. Hajdu. Why hasn't Canada fully laid out a battle plan like the UK did yesterday? And what are the what are the possible contingency plans that you have in case 1/5 of Canada's workforce falls ill?
Well, I'll start and actually might turn to Minister Freeland. I think, first of all, we do have battle plans. And the nice thing about Canada having gone through SARS, and it was a very difficult experience, as some of you will recall, was that it really was a clarifying moment, I think, for Canada and for the provinces and territories, that we needed to have a pandemic plan, that we needed to have bodies of people that can quickly stand up in the case of a global health threat like the coronavirus. And in fact, that's been happening since Dr. Tam noticed those very early clusters of cases in late December in Wuhan. That pandemic plan provides the backbone for us in terms of a global health response. In terms of the whole of government response, as I said in my remarks, we've been doing scenario planning now for a couple of months through our government officials who have been looking at all kinds of different scenarios and what that might mean from a whole of government response, a whole of country response, if you will. And today's announcement around the special committee is really the ability to take action quickly on those scenario plans. And I'm grateful to the civil servants who have worked so hard to make sure that we are considering the multitude of details and the multitude of sectors and the multitude of ways that any kind of significant outbreak could affect Canadian society. So I'll turn to you if you'd like to say a few more words about that.
Yeah, no, Patty is exactly right. And I ought to have said in talking about the work the committee did today, one of the key elements was going through some of the scenario planning, which the public service has been engaged in not just for weeks and months, but really since SARS. And one of the reasons that I think we should all be confident that Canada is well positioned to deal with this serious situation is, as a country, when it comes to public health, I think the lessons of SARS have been studied very, very carefully and have had a real and positive impact on our preparedness for this kind of situation. So we are very much doing scenario planning. We're doing it at a very detailed level. At the same time, I think it's important for us, both in terms of public health and in terms of our economic response, to seek a sort of, I would call it the Goldilocks response. Not too hot, not too cold. It's important for our response to be adequate to and appropriate to the situation in which we find ourselves. We can't be slow in responding, but neither should we overreact. And that is very much our government's objective. Having this cabinet committee that can meet very frequently, be in very, very regular contact, is going to help us to do that, because it means we can calibrate very quickly.
So then, just as a follow-up, what are we doing now? Because the economic impacts are being felt now, not in weeks.
As I said, I think that it is quite reasonable that at the first meeting of our committee, we wouldn't be taking decisions right away, decisions on the first day, but we are very mindful of the fact that an economic impact is certainly being felt in the global economy and is beginning to be felt in Canada. And that's one of the things we need to turn our attention to, and to turn our attention to quickly. So I would just say about that, watch this space.
Okay, David Lundgren, Reuters.
Quick couple of questions for whoever wants to answer them. At what point would you consider escalating the federal, provincial, territorial response plan for biological events to level 4, the emergency level?
Well, that's purely based on operational requirements. So we're already functioning at a sort of daily kind of pace. But at the moment, in Canada, we still have the cases just linked to the travelers and the close contacts, and the health system is managing with the provinces and territories. So it's escalated based on a set of criteria, but really is about the level of coordinated response that we need. We're already coordinating. It's just a matter of the intensity of that response.
Given the rapid spread in the States, why have you not done this already? I mean, the States is next to Canada. It is, there's millions of people moving across the border every year.
The level of the plan, which is right now, is exactly what we need to affect daily coordination with the provinces and territories, which is what we're doing. Plus, we are looking at our border measures and our public awareness approaches. So, with the United States, we are in constant contact with them. But I think calibrating, I think we've all said that, is important. This is an actual marathon that we're on. Right now, we're at a pace which is commensurate. Our FPT coordination pace is commensurate with the requirements of where we are now, and we then have the flexibility to escalate as we need. But right now, this is appropriate for what we're doing now.
And just on the U.S. aspect of things, as Minister Hajdu said, she spoke to her U.S. counterpart today. I was in touch with the White House yesterday. We are working very closely with all the provinces and specifically with British Columbia. Premier Horgan has been in touch with the Governor of Washington State. We are very aware of our shared border and working very closely both with our U.S. counterparts and with our provincial counterparts.
Ryan Tumulty, National Post.
Yeah, Minister Hajdu or Dr. Tam, I'm not sure who's the most person for this answer. You've both talked about so far the transmission has all been related to travel and that you believe you can delay community transmission. Given the scale of the epidemic globally, do you expect eventually you will see community transmission cases here? You've talked about delaying that. I'm just wondering if that's all you can do.
I think both Dr. Tam and I have said on numerous occasions that we can anticipate that there will be an outbreak in one of our Canadian communities. I think this is, as I said, a virus that knows no borders and that is growing, and we're seeing an increasing, each day there are countries that have new cases and new outbreaks and new situations. Obviously, we're working very diligently together with provinces and territories to prevent that from happening. But the reality is this is an evolving situation, and that's why it's important that we consider that eventuality, that we're not taking for granted that we can contain solely to cases that have been exposed to international contacts, but that we know that eventually this is likely something that we'll see in one of our communities. To Dr. Tam's point, that work is happening at a local, a provincial, and a federal level. And I do want to take the time to just congratulate the local public health units all across the country who are doing the lion's share of making sure that we keep those cases contained. For those of you who don't know the level of effort that goes into contact tracing, it is enormous. People are following the close contacts and the sometimes distant contacts of people that have become ill, and making sure that we know how that train of transmission is actually proceeding, and trying to stop it. And that is how we actually contain things from moving to a community outbreak. But having said that, it is a difficult piece of work, and sometimes it's hard to track every single person that has had contact with an individual who's ill.
So if we do get to the community outbreak stage, how will the response change?
It depends on the nature of the outbreak, and it depends on the nature of the extent of the outbreak. First of all, of course, the health system will be supported both through the provincial system, but also federally should there be additional need. And of course, each situation would be different. There might be a need for more protective equipment, for example. If the province can't meet that need, then the federal government has an ability to support additional demands on equipment, for example. There may be be decisions taken at the local level by the local public health authorities in combination with the provincial health authorities about canceling events or about keeping schools closed. But those are all really dependent on the particular situation of that outbreak and the particular situation of that particular community. Obviously, we work very closely in consultation with the provinces to make sure that they have the supports they need to take those very difficult decisions.
I'm going to try to squeeze one last person in, and I apologize to those on the teleconference because we won't be able to get to that unless the ministers are able to stay a little bit later. Ton McCharles, Toronto Star.
Thanks. Can you give us an update, please, on the current status of the Canadian cases? Particularly, are there any cases at all in Canada that are in hospital, and the Canadians in Japan, what is their status? There were some, I believe, in critical care. Has anyone died that you know of? Can you give us an exact update?
In the Japan situation, our Global Affairs Canada has been keeping a daily contact with the families and the patients. So, and that situation might change on a daily or hourly basis. At the last update very recently, there's still 3 to 4 Canadians who are quite sick, and they're still hospitalized. Others have a milder illness, but many of them have completed their healthcare period, and they've tested twice negative, and some of them have come back to Canada as well. But I believe there's at least 3 to 4 Canadians who are still in a serious condition. In the Canadian context, I would always refer you to the provinces and territories because you know, they will have a much better idea of the exact clinical status of their individual cases. From what I know at the national level is that the majority of them have been mild illnesses, but there is at least one person who is in a more serious clinical status. But again, that will change and is up. I would refer you back to the province for those kind of updates.
And perhaps you can clarify which province you're referring me to.
So the cases are in Ontario, BC, and Quebec.
Me, though, in one particular case to one province. But anyway, I'll get on with my follow-up. If you could clarify what province you're referring me. You said there's one case and you've referred me somewhere. So if you could clarify that. My second question is, you've talked about lessons learned since SARS, and you've talked about making sure there's a national response here, and yet Canada does not seem to have kept pace in terms of the advice for nurses and healthcare workers in acute care settings on N95 or better masks protection. The US, the UK, Europe have gone to the point where recommending better protection for those healthcare workers, and Ontario has, but as a national guidance, you haven't given that. Can you explain that, please?
There is interim guidance for infection prevention control, and that is guidance from an advisory committee of experts. So those have been in place, and they will be updated on an ongoing basis based on the scientific evidence. So the scientific evidence today is that this virus is transmitted by droplets, and droplet spread, contaminated surfaces as well, for example. There are specific situations where aerosols can be generated in certain procedures, in certain health facilities or healthcare facilities. And so the advice being provided, which will be updated, as I said, on an ongoing basis, is that there is a best piece of equipment, a physical arrangement. So it's not just the personal protective equipment. There are engineering requirements, physical arrangements for specific clinical sites. Personal protective equipment is one layer of that, and the recommendation is based on what kind of procedures a healthcare worker will be doing. A very important aspect of this is the flexibility provided to the individual health provider to assess the risk in front of them. Who is the patient that they're encountering? Is there a risk of aerosol-generating procedures? And they have the flexibility then to use the type of equipment that they need. We're certainly in line with the World Health Organization recommendations, but you know, I think protecting healthcare workers is absolutely one of the most important things that we should do. It's not about that certain mask at one level higher. It is about the right protective equipment for the right set of medical settings or procedures. But I think it is very important for us to listen to the health providers and consult with them on an ongoing basis as well. And I know that that has occurred with the minister as well.
Absolutely. Last week I had an opportunity to meet with Linda Silas of the Nurses Union, and we had a conversation about making sure that workers' voices were involved in these conversations, and I committed to her that she would be involved, or designate of her choice would be involved in some of those technical working groups where they're working through the evidence and trying to determine how to apply that in their own particular healthcare settings. So obviously, as the former Minister of Labour, making sure that workers are protected is of utmost importance. And so I agree with Dr. Tam that this is an evolving conversation, but workers' voices have to be in that conversation, and that's the commitment I made.
Yeah, and I would just like to emphasize one thing that Minister Hajdu and Dr. Tam have emphasized all along, which should give Canadians confidence in our approach to this situation, which is ours is a government which believes in science, which believes in a fact-based and an approach informed by the advice of experts. That's the approach that Minister Hajdu has been taking from the outset. That will continue to be our approach. And I would just say on a really personal level to Canadians, this obviously can be a worrying and frightening time. And I would really urge everyone, listen to our doctors, listen to our public health officials, listen to the experts. That's where we as a government are taking our guidance from. And I would urge all Canadians to do that.
Okay, thank you very much.
Thank you very much. I see some eye rolling with the wash your hands message, but I do want to say that it is an important piece of information for Canadians. We can empower ourselves as Canadians to protect our health. Obviously, there will always be cases where we become ill, but I think it does bear repeating that there are a number of measures that people can take in their own personal lives to protect their health and safety, basic hygiene, but also staying home if you're sick, and making sure that if you do have people with vulnerable health issues in your life, or they are in a nursing home and you're not well, that you're making sure that you're considering how exposing yourself to them would compromise their health. And these are all things that we can do to take care of one another. This will really be a time, should we see a community outbreak, where we're going to need to pull together as Canadians, and I have every confidence that we can do that. Thank you.
Okay. Thank you very much, and thank you for staying later than originally planned. And my apologies to anyone who didn't get a question either in the room or on the lines.